I was able to go and visit every other day, but I was constantly on edge, not knowing whether the restrictions were going to change. And there were times when, it looked like they would. I was also worried about what would happen if I got COVID and wasn't going to be able to visit him, or even if I knew somebody who did and had to isolate and couldn't visit. But I think one of the hardest things for me was there was a time where there were very few COVID cases in the ICU in the hospital, and then all of a sudden that changed, and the entire ICU was full of patients with COVID. So they had to create a second ICU. And I didn't really understand what was happening. I went one day, and the volunteer who was at the desk greeted me and said, "Did you know they moved John to another room?" And I said, "No, I didn't know." And she said, "Well, let me show you." So she took me through a whole bunch of hallways. I didn't know where we were going, and we ended up in this, it was like an old storage room. I think it had been a former a room for the operating theaters. And it was old and dingy, and there were 4 patients, and John was in the last bed. And I was devastated. It just felt like he didn't matter. It wasn't important that he be taken care of, that COVID was the most important thing, and those patients were higher priority. So that was really, really difficult for me to experience that.
It definitely makes your patience for what I'm trying to say is getting you become someone who wants to do whatever you can to stop the pandemic, and that's a broad thing to say, but you see it firsthand. This affected us in this way, so yeah, your patience for, I guess, COVID becomes very, very, very small.
Yeah. It also made my life very, very small, because I had to limit the number of people I had contact with, because I was so worried about getting sick myself, that, I saw Aidan and I really saw one friend. I mean, I talked to people and I sent emails and texts and communicated that way, but my world became very, very small. I mean, very much focused on the hospital, but very small.